There we go. Everybody's slowly getting in here with always love all the additions, and then Zoom doesn't quite work right just as you get everybody in and trying. There we go. Everybody's slowly getting in here with always love all the additions, and then Zoom doesn't quite work right just as you get everybody in and trying to upload and all that. So welcome everyone. We'll get started momentarily here. Usually I'm not a big fan of waiting, but I think today we're going to give it just a moment because of the delays we had. So I'm going to start off. Everybody, okay, I'm not keeping up with my screen. So there we go. Welcome everyone. We'll go ahead and get started with some of this here. I think people should be joining in. We may have a few late joiners here, but welcome to REIA Now. We do want to have kind of a little discussion on the for leaders, and we'll open this up here. Rich and Julie are joining us today and give a little update on some health issues and health insurance and such. So I want to make sure we got plenty of time for that. This is one of those blessedly, I don't have a whole lot to give you on the legislative side, so that's a good thing. So let me touch on a couple of things real quick before we get started. We are here to educate and promote. Okay, so we're going to start with thank you. Thank you. How about that? Okay, go to the next one. We do want to thank our sponsors, seriously though, with Home Depot, and yeah, I can't even begin to. I mean, Brian was great, just catching up with him earlier in the month, and just if you are having any concerns, make sure you reach out to Karen in our office. We really appreciate the relationship with Home Depot and just want to make sure that we continue on with that. So thank you for that, Home Depot, and everything you guys do for us. So let's make sure our folks are all registered and up to speed on everything, and we'll go from there. Today, I'm going to touch on a couple of things real quick, and we're also going to touch on, have Rich and Jeff talk. And when Rich talks, Rich actually gets Julie as well. So you get 2 for 1 on that one. But we're going to talk a little bit about the healthcare program. Jeff's going to touch base with us and give us an update on the transparency, on the Corporate Transparency Act and what we need to do on that and some of the regulatory updates on that. For now, I'm going to jump into a little bit. You want to pull that down there. Just a couple of things. First of all, for those of you who were able to attend in February down in Orlando, it was Miami actually. I don't know. It was somewhere in Florida, another hotel. But the interesting thing was I showed a screenshot that just showed the amount of regulations versus the amount of legislation that's been done. We are at the lowest level of legislation passed on a federal level that it's potentially historically going to be actually the lowest ever. This is an almost dysfunctional Congress at this point, which I know most people would say that's just normal or it was redundant. But what I really mean is they've only passed 20 bills. Normally they would pass a couple hundred. And the bills that did pass were things like a naming of a veterans facility for somebody who lived there locally. Those are the kinds of things that are passing right now. So when we talk about a logjam at the congressional level, there is nothing going on. It's locked up tight as can be, and probably will be, honestly, until we get past election day. So the federal side is pretty well tied up. The state side, I will encourage you to make sure you are thoroughly engaged on. The states are moving on issues. The states are being very active. There's, I think, 191 bills right now across the country on rent control, and they range from everywhere from, Jane, Illinois, you've got one where it's like you can only once a year raise the rents by this amount, by this percentage, if you give notification this far in advance. I mean, versus Idaho is saying, yeah, no municipality can do that. It's like there's a preemption law they're putting in place. So make sure you are engaged. And this is especially true because most of us are aware of the equity groups that are out there and what's becoming called big housing. There were hearings on this last year, last February and March. There was a couple of hearings in DC, and it has continued to snowball, and especially with the housing. I won't quite call it a crisis in that sense, but the housing affordability and accessibility. Gee, Jeff, it almost sounds like we have a bill like that somewhere along the lines. If you go to your um, onto our advocacy page, there's actually a way you can support that bill, the housing advocacy affordability access page. So encourage you to do that. Reach out, especially if you're in Ohio or in Alabama. Both of those areas we're trying to engage the Senate on. But that bigger issue of big housing, not only are the local elected officials, the state level elected officials, and the federals focused on it. The federal's not moving forward, but the states are, and the states are moving in part because the feds are not moving. So this is one of those times, all the more I encourage you to make sure you are at the table, or you are going to be on the table, because what gets classified as big is, beauty is in the eye of the beholder. So the definition of big, whether it's somebody who owns 10 houses, 50 houses, 1,000 houses, or is it 20,000 houses? Everybody kind of goes, BlackRock's big. Okay, well, where's the cutoff point? And that's really where the discussion is at, is the government coming in saying, we're going to tell you where the cutoff line is. And folks, if you're not at the table, we're past whether or not there should be a cutoff and whether or not capitalism's allowed and you can be able to do the things with your money. We're at the point where we're having the discussion on how much the government can tell you on to stop how much you can grow your business. Now, those of us who have been struggling against some of these larger groups, we know what it's like. They oftentimes have money that they have to expend, and they have to get it out there because of an equity distribution and equity efforts that they have to get the money allocated. That being said, make sure that you are at the table, that your legislative group is at the table with your local and state groups, because there will be legislation coming out. There are more and more times we're seeing it pop up, and the limit is anywhere from 30 to 50 to 100 homes. And if you own or participate in ownership of more than that, then the different types of fines and fees start to come in. So that's my just really a caution and an urge to make sure you're engaged at that local and state level. The last thing I will mention is we are joining NAA. Remember, this is coming up on, it's March 12th and 13th in DC. Love to have a couple people from each area. Just come up, each committee, each chapter, each affiliate. Love to have you come up to DC. If you've got questions on it, want to give me a call, don't hesitate. Just shoot me an email and we'll get a time we can do this. This is the most important time to come up because we can go up and meet with elected officials. Walk the halls, and we'll walk you through the issues, walk you through the policies, hand you the documents, and go up and do this. And we can do this in partnership. We're doing it in partnership with National Apartment Association and National Multi-Housing Council. So it's a good time for those of you who've been, those of you who have not been, encourage you to come up. Love to be able to have a little more larger group this year, maybe 25, 35 of us up there, and do some walk-arounds that way. So that's the main issues I want to touch on. If you have questions on that, let me know. If you'd like to reserve a spot, let Lori know, and we'll make sure that we've got you listed on that. So with that, I'm going to transition over for Jeff Watson here, who gave us an update on this Corporate Transparency Act. Was that December or was that November? We talked about that, Jeff. Now my brain's starting to mush up on me. But
well,
he
you've
gave
only
you
had
a
a few
heads
things
up
going
to
on,
say,
Charles.
this is coming. You say, God bless caffeine.
Yeah,
So,
yeah.
but this issue of transparency is coming up very soon. I shouldn't say coming up. It's already here. January, the rules went into effect. And so with that, Jeff, why don't you touch on that real quick on what it is we're looking at?
I've got some slides if you want me to show them. I can just talk about it if you
That would
want me
be
to talk
great.
about it. Okay, let's see if we can do
Sure.
a share screen. All right. And Let's go. There we go. Okay. Hopefully you're seeing a slide that says the CTA, which is the Corporate Transparency Act, aims to ensure that reporting companies identify all individuals with substantial control and those who own or control at least 25% of the ownership interest. Now, what we'll get into is what some of these words mean. And I can go on for about an hour, but I don't think I've got that kind of time. So I'm going to make this quick hit. So we got to understand who must report. Owners, individuals, the carbon-based human life form. And I don't care how many layers of cloaking and daggering and dodging and ducking you have. They cut through all that. They want to know who are the carbon-based human being breathing life forms that own 25% or more of an entity that has $1,000 or more of assets. Let me be straight up with you, folks. This is what you need to start telling your people. If you have an LLC that doesn't own anything, but it has a contract to buy something, that contract is probably worth more than $1,000. So it needs to have, so it has that value. It has to report. Okay. Secondly, those who have substantial control over any entity with $1,000 or more of assets. When I say entity, I'm talking about single member LLCs that are disregarded. I'm talking about single member LLCs that are electing to be taxed as corporations. I'm talking about multiple member LLCs that are taxed as partnerships. I'm talking about multiple member LLCs that are being taxed as corporations. I'm talking about partnerships. I'm talking about joint ventures. I'm talking about S Corps. I'm talking about C Corps. Any type of entity that you have to go register with a Secretary of State or the tribal land equivalent. That is what's out there. All right. Now, here's what's important. And this is the other half of the coin. You do not report what is owned by the entity. The IRS already has a pretty good idea if you've been filing a couple of tax returns. Now you have to report who owns the entity. So between the IRS database and the FinCEN database, they should have no surprises as to who's got what. Okay. Now, ownership interests, very broadly defined under the Corporate Transparency Act, and encompasses various instruments, including but not limited to all the creative stuff that we investors can come up with. Any sort of scheme, strategy, or idea that you think you've come up with, they've covered it. If you've got an equitable interest in a property, in an entity of 25% or more, you need to be reported. If you have a certificate, if you have a membership interest, if it's a stock certificate, if it is a bearer, and oh, by the way, it covers bearer instruments and bearer shares, okay? Interest in a joint venture. You say, well, Jeff, I don't directly own anything. I've just got these controlling interest in these joint ventures that kind of control these entities. Nope. The way they look through it, they want to know who you are, okay? Convertible instruments. Oh, well, Jeff, I put some money into this LLC that two other guys are running. And my money can convert to a membership interest if I want to, but right now I'm debt. If it converts, you need to report. If it can convert to 25% or more ownership, you need to report as being 25% or more owner. If you're using a trust to hold your shares of an LLC or a corporation, you need to report. If you're using a trust within another trust to own your shares of a corporation or membership interest of an LLC, they look through all three trusts and they go report who owns it, who's the human being. All right. Equity pledges, the same thing. If you've got an equity pledge arrangement where it lets you have direction and control over the company, you need to report. Okay. Ownership interest, there are all sorts of methodologies that people try, whether we try trusts, beneficiaries, nominees, grantors, intermediaries, all of that. Any sort of structure that we have, that we've come up with through decades of doing deals and being creative, any way that you have a claim to it, If it's 25% or more of the ownership of an LLC or a corporation, you must report. But it gets better, Charles, as they would say, but wait, there's more. We'll get into this. I want to skip over a couple of these slides because we're going to get right to the material that matters. You need to know which of your companies are reporting entities. If it has an asset of greater than $1,000, it's a reporting entity. You need to understand who all the beneficial owners are and the disclosure information that's required. Depending upon when that entity was formed, different types of information are being sought by FinCEN. For any entity that existed as of December 31st of 2023, they want to know two things. Who owns 25% or more, so you could be up to 4 people, or who has substantial control, which could be 1 or several people for every one of those entities. For any entity created in January or February of this year, they want to know those 2 things, but they also want to know a third thing, which is who helped you create the entity? Who is the applicant that filed the paperwork on the Secretary of State website to gain this information? Yes. Yeah. It gets, oh, it's there. This is reaching. They want, then you need to timely file the required disclosures online with the Financial Crimes Enforcement Network. Now, let me be clear about this. This is a brand new government database and website built by the lowest cost bidder that outsourced it to somebody else. Do you think it's got some bugs? Yes. So when do we want to do this? We do not want to be in the front of the crowd because we're not sure the website's working right. We're still trying to figure out what the rules are. By the way, they just issued some more guidance in the last week affecting trusts and so on. So we've got to be clear on this. Do we want to be like the typical entrepreneur real estate investor that we wait until Christmas to think about tax planning for 2024? Or do we want to wait till then to file? No, we don't. So I'm recommending that if you are allowed to, for every entity that existed at the end of 23, every entity that existed at the end of 2023, think about beginning to report them in May, June, or July. We want to get it in before the end of the year. We do not want to wait for the website to break. We want to make sure that everything's functioning correctly. And folks, you're going to have to make a serious business decision. And this is the first time I've really talked about this, Charles, but I'm just going to say this. You got to make a serious business decision. Is there a reason why you want to continue to use those LLCs and report that you own that LLC? Or are you just going to say, listen, I trust my neighbors. I trust the people I do business with. I have good property and casualty insurance. I have good operational maintenance policies in place. Do I now want to not use LLCs so heavily? I predict we will have a lot less LLCs being used going forward because people are going to be like, if I don't have a specific tax benefit for it, I may not want to give up my privacy in exchange for having this LLC for what may be a liability shield, what may not be a liability shield if I can adequately insure. I think a lot of people are going to start making those decisions. For example, I'll show you a chart where I think you're going to see people make a change in the future going forward. All right. Let's get some definitions down. Well, right here it is. Right here it is. So in the past, this was a very common way that landlords would own real estate. Very common way. The property would go into a trust. The trustee would be the owner of record. The trust would be owned by a single member LLC. Each house up to a certain amount of equity would have single member LLCs. You might have 3 trusts owned by one single member LLC. When you got to $500,000 in equity, then you went to the next single member LLC. You could have 5 or 20 houses set up this way. Each of these single member LLCs would then be owned by a master multiple member LLC that is owned by you, your spouse, your partner, your adult kids, your parents, whatever. I predict going forward, you're going to see a lot of these LLCs go away. Why do we need them? Why do I want to have a second layer of asset protection when privacy matters more to me? We'll keep this one because of the tax benefits, We'll keep this one because of we get our liability shield predominantly from here, but we're going to give these up because the risk of failing to report one of these and incurring up to $10,000 in fines and potentially being a felon isn't necessarily worth it. I think you're going to see some people go that direction. Here's another illustration. We may see a lot of these go away. Okay, but right now, we're going to see they don't care about this. What they care about is reporting this. These 4 LLCs must report. And so people may sit down with their spouse, their partner, whatever they're in business with, and they'll look over the rental portfolio and they go, you know what? We're just going to go down with this one LLC. We're going to get rid of these 3. They may make that decision. I don't know. It's a balancing act of how much do you want to report to the IRS versus the risks that you're taking. Report to FinCEN versus the risks that you're taking for asset protection. You got to make that decision. Am I going to make some changes? Yes, I'm going to make some changes, but that's more in how I practice law than anything else. But let me get into some things here, some definitions, Charles, and then we can open up to questions. Substantial control. An individual is deemed to exercise substantial control if they serve as a senior officer of the reporting company. If you're the manager of an LLC that has $1,000 or more of assets, you have substantial control. You need to be identified in the FinCEN reporting for that entity. If you have authority over senior officer appointments, or if you have authority over the majority of the members of the board of directors, you have substantial control. If you can influence important decisions, including those related to business operations, asset transactions, equity issuance, debt, contracts, and governance documents, you have substantial control. Let me give you an illustration about this. Let's break it right down into the good old mom and pop real estate investor world. Mom has an LLC that specializes in buying ugly houses, fixing up and reselling them for a profit. Fantastic. Husband can show up at the job site. All of the contractors know who he is, and if he tells them to do something, they do it. He has substantial control and needs to report as having substantial control, even though his spouse owns the entire LLC. That's a very specific real-world example. Now, I think this is overly vague. I think they're going to keep it deliberately vague so that they're going to argue that if you think you have substantial control in any way, shape, or form, you need to report. Okay? The term beneficial owner means with respect to an entity, corporation or LLC, partnership, joint venture, an individual who directly or indirectly, see that word indirectly? It's there. So either directly or indirectly, through any contract, arrangement, understanding, relationship, or otherwise exercises substantial control over the entity or owns or controls not less than 25% of the ownership interest of the entity. This is a beneficial owner if you either directly or indirectly through any sort of deal, arrangement, understanding, relationship, documentation, planning, structuring, devising, scheming, planning, whatever, exercise substantial control over the entity, i.e. you can show up and say what needs to be done. You can move money around in a bank account. You can tell somebody how to spend the money, or you own or control not less than 25% of it. It's that simple. Does not include if you've got a minor child that's yet to inherit. If you've got an individual who is acting as a nominee, intermediary, custodian, or agent on behalf of another individual, they don't have to report. Where this matters, and this, Charles, this will probably be my last slide, okay, unless you want me to go longer, okay? This matters if you have an IRA-owned LLC, if you have what they call checkbook control, your custodian, your agent for custodian does not have to report. You, as the account holder, are who they're looking for to report. It has to go back to you. And now the great news is when you do this, guess what? They don't want your social security number. What they do want is your passport number or your driver's license number. And they want a copy of that government issued photo ID. When you file, you have to update with with a picture of your passport or a picture of your driver's license. And you have to enter the number off that passport or off that driver's license, because they want to be able to track this down. And you're going to have to give up your address, and they don't want your mailboxes, etc. They don't want your PO box. They don't want your UPS mailbox. They want the physical street address where you lay your head down at night. They want the physical street address where your actual business is sited and located. Now, somebody's going to say to me, but Jeff, I'm a digital nomad that flips houses from wherever I travel. Great. God bless. What address do you have on your driver's license? That's the address you give them. There's a lot of things that this is encroaching on. Charles, I'm going to wrap it up with this. The Corporate Transparency Act is the biggest thing to come at the business community, particularly the small business community, since the Tax Reform Act of 1986. This is going to change the way most people think about and do business and operate businesses and structure them and organize them and so on. This is going to really be an invasive, all-encompassing thing. And then we're going to have this massive federal database that's going to be prioritized as just under classified as secret. And they're supposedly going to protect it, but we know full well that the Chinese, the North Koreans, the Russians, the Bulgarians, the Romanians, and every other hacking organization out there is going to get this stuff. So my last recommendation, folks, and I've said this so many times, if you do not yet own identity theft insurance, go get some. If you do not yet own identity theft insurance, go get some. And I'm just not talking about credit monitoring. I'm talking about actual insurance plan. I'm not going to name any companies. I've got 2 different policies myself. But go get some identity insurance, because your identity, as you own more and more, is more and more at risk, more and more vulnerable. And I'm going to this last thing. This is bonus material. Please, when you're doing this, use this as an opportunity to make sure that all of your corporate filings are up to date on your respective Secretary of State's websites. It is amazing how easy it is to go into certain websites like sunbiz.org and take over somebody else's company. Make sure your stuff's up to date. Charles, I got more, but I'm going to pause for now and yield back the balance of my time. I'm going to stop sharing if that's all right with you.
Well, I appreciate my colleague reporting on this issue. I think everybody's sufficiently terrified at this moment. The eyeballs I'm seeing, the questions are not coming in. Like, I mean, I have several. Jeff, I go back to the one where you said they're not interested in the trustee side of it, but they're interested in the carbon-based life form and the LLC behind it. What happens when the LLC is in the trust, and then the trust is the irrevocable, and you're the beneficiary of the irrevocable trust? I mean, that
they want to know you as the
beneficiary
beneficiary of the irrevocable trust that owns the LLC. Yep. Sorry. They're going to want to look through the trust.
So
they're looking for the human. Yep. Now, Brad's shared a link of some of the stuff I've written. Brian asked this question, how do you report this? There's a specific website that FinCEN has up. If you just Google FinCEN Corporate Transparency, you'll find the website. Does your registered agent's address work for your address? No, absolutely not. No way. They're very clear in the 100 plus pages of regulations that is not acceptable.
So, and Jeff, I want to go back to your point of don't delay till December to address this. This is one where you're going to want to, now, I don't necessarily want to be the first one in January to comply, but by summer, you better be getting this figured out, because you may have to go back to your Secretary of State and do some other stuff and have the time to do it.
Yep.
And the government has no problems putting you in a situation that you cannot get out of. And I'm going to share this. I've been working with, I've been very involved. Okay. Since everybody knows I'm a candidate, I'll mention it this way. I've had a discussion recently with a number of county auditors. They literally have to have a code to enter in their 1099 forms that have to be filed by January 30th. They cannot begin to file until after January 1st, at which time they're notified, by the way, it will take 45 days for them to receive the code that's required to submit their information. So every auditor is now out of compliance. And if you know auditors, that's the number one thing they're focused on, is in compliance. So the IRS is literally set up every auditor to fail on that issue unless they can come in under somebody else's number who happened to have a number previously for whatever reason. But it's just so.
Yeah. And Charles, to your point, do not expect sympathy
getting
from the
ducks in a
government.
row.
Do not expect sympathy from the government. Folks, do not procrastinate. You have got to get serious about this. And I think that before you think about a summer vacation, before you think about celebrating the 4th of July, you had better be making substantial progress on identifying all of your entities and verifying their good standing, dissolving the ones that you're not going to use, dissolving the ones you have no intention of using, and then getting everything else reported. And that means literally somebody for every LLC is going to be responsible for making sure that that LLC is reporting. That means if you are a manager or a co-manager, you better be on top of it, and you better make sure you've got a copy of the driver's license or passport for every other member of that LLC that has 25% or more interest or has substantial control.
All right. Well, this is not the
Now,
last we've heard of this. We will definitely have more on this, and keep an eye out. As Brad posted, there's a link there. I encourage you to read that. Keep an eye out on Real Estate Investing Today. We'll have more up there on that, on this issue. And again, just word to the wise, make sure you're getting your ducks in a row on this issue and don't wait. So thank you, Jeff, for that
you're very
terrifying
welcome.
update.
Yeah. Sorry, I didn't bring good news. I had to bring the harsh dose of painful truth.
Here, I got to tell everybody not much is going on at the federal level. Oh, except for the regulation that they passed, by the way.
Oh,
That
you
was
ready
a
for
joke.
this?
So
I'm gonna, since we're raining bad news, we might as well drop one more.
go
Last
ahead.
week, FinCEN circulated a proposed rule to where cash transactions of real estate are now a suspicious activity. Let me explain. If you would go into the bank today and try to deposit more than $10,000 cash to an account, the bank
Right.
would be required under AML, anti-money laundering laws, and BSA, Bank Secrecy Act, to file a SAR, a suspicious activity report, with the FBI. FinCEN circulated a proposed rule that is going to be released, I believe, on the 16th for comment, that now says a cash purchase of residential real estate should have a similar reporting requirement as if it was a suspicious activity.
So any property I buy off the courthouse steps with cash just became suspicious.
Because you used cash. Yes.
Oh, well, we'll be getting the information out on that and get ready for some feedback, folks. We'll figure out if there's a way to make it easily accessible and provide feedback on that. So,
Yep. We're going to dig into it, and I'll let you know more,
right.
Charles.
Sounds good. Thank you, Jeff. Always wonderful to have good information. Good news? I don't know. Let's try some good news. Rich, Julie, do you guys want to give us a little good news here? Maybe we can kind of talk about a little bit on the insurance side of things, how to protect ourselves. Maybe some
Yeah, hopefully we can.
I would Greatly appreciate it.
I was just thinking that. I was like, well, I think our presentation's kind of happy good news, but we'll see.
Excellent.
Let me try to activate my screen share here. So my name is Rich Lawson. I'm with the Small Association Leadership Alliance. We are an association similar to yours. Our members are other membership associations. And is my screen up there, Charles?
Yes, you're good.
Awesome. Okay, terrific. And we've been working with your organization since the summer to offer the SALA Healthcare Program, which is one of our services that SALA offers to our members. So I'm very pleased, and I think it's good news that the SALA Healthcare Program is now available to members of your organization. And I'm going to spend a little bit of time going through how the program works, why it is what it is. And we got a guest speaker from Sedera, which is one of the components of the program, Julie Silverman, who's going to take some time to go through the slides about Sedera. So let me jump in with that. So as I said, we're a membership organization. We do a number of things. The SALA Healthcare Program is a healthcare solution that we offer through our members. So this is not a direct-to-consumer type of program. It's available through associations, including yours, across the country. We put the program together in 2017 and have been actively involved with our partners in offering the program since the fall of 2018. Our original goal was to offer an association health plan, which is a traditional insurance approach for associations, but we ran into a couple of problems with that. The first and probably most relevant one is that insurance is offered, priced, and regulated within each of the states. And it became pretty clear when we were going through our process that you couldn't offer a national kind of program for organizations like yours. So the program I'm presenting is structured the way it is because we had that requirement of being able to offer something across most states at a consistent pricing level, and also had to achieve the goal of reducing costs. You see down at the second to last bullet, the average cost savings we're seeing across the country and across our various members that are offering it is around 50 to 60% savings off your monthly costs. It varies a bit depending on where you are in the country, what kind of competitions you have there. And also, if you have any sort of eligibility for a subsidy at the federal exchange or state exchange, that obviously affects that number as well. But apples to apples, we're seeing about 50 to 60% savings monthly. And finally, our last bullet, SALA does periodically survey members to see, what's going on with the program, what their experiences are like. And as you can imagine, we were very delighted to see a 91% rating as being either very extremely satisfied with the program overall. So let me talk about how the program works. Now, I mentioned it's a little different than traditional insurance because it is a national offering. As such, the program is built around two primary components. One are preventive care plans offered through our partner eBenefits Administrators. There's two choices plan about in a moment. And then the major big stuff, hospitalization, surgeries, serious accidents and illnesses, things like that, are handled by the second component of the through Sedera. And as I mentioned, Julie's here to talk about that. There's also a dental plan option that can be added in that uses the Aetna Dental Providers Network. So I think the best way to understand how these components work in the program is to think about your healthcare in three silos. So on the right side of this slide, you see preventive care, and that's purely preventive care as defined by the Affordable Care Act as 80 approved preventive care services. And those are things such as mammograms, colonoscopies, annual well visits, childhood immunizations, things like that. They're both handled, they're handled by both plans, the Essential and the Summit plan, at 100% coverage with $0 copays. And there are some differences between the plans, which I'll talk about in a moment. And then you got the small to medium cost or your day-to-day costs. And those could be things like a cold or a flu, sinus infections, maybe it's a twisted ankle and a trip to your urgent care, things like that. And then on the left side, you've got the really big stuff. So Sedera is the partner that provides for those instances or those needs that you have, that include things like accidents or illnesses, hospitalization, surgeries, cancer diagnosis. It's all the major stuff. So Julie's going to talk about that, and we can hand that over to her. Julie, I'm going to unshare now. My computer's running a little slow, but I think we should be able to do this. So let me stop my share now, and you can pick up.
Thanks, Rich. So you should see my screen. It says Select Plus for Teams. You've got an image in the background. It's really great to be with you all today. My name's Julie Silverman, regional sales rep for Sedera. Have been with the company for almost 7 years. Have seen quite a bit of change in the healthcare space, and yeah, I think our part of the call might be a little more uplifting. I'm super excited about where healthcare is going. I think a lot of people don't realize there are different ways of paying for healthcare. Sedera is one of those options, and I'm going to talk about how it's a bit different. And Rich set it up pretty perfectly. Sedera is there for the big stuff, right? The accidents, illnesses that you want to protect from. If you had a cancer diagnosis or tore an ACL, needed to have surgery, had a heart attack, you're rushing to the hospital and need care. These are bills that would leave you in a pretty bad place financially if you didn't have a plan in place to pay for them. And that's really what Sedera is there for, but a community approach rather than through insurance. I think this graph does a pretty good job of showing the problem over the last 10 to 15 years. Deductibles have gone way up. If you're unfamiliar with the terms, the deductible is the amount that you pay before the insurance company is going to help pay your bills. Premiums have gone up significantly as well. The premium is the monthly cost you pay to have insurance. And then that green line at the bottom, workers' earnings, what we take home and pay hasn't gone up quite as much. So we call this the unsustainable squeeze. It's why so many people, frankly, can't afford insurance these days. Sedera is not insurance. I mentioned that before. This is a community of people contributing each month towards a larger community fund. And when someone in our community has a medical event, we use that fund to pay for their medical care. It really empowers individuals to make their own choices when it comes to the medical care they need, what providers they see, and really opens up the door for choice in the medical world as a patient. And I'm going to talk about how we do that now. So in the Sedera world, we look at everything in terms of a need. A need is one or more medical bills caused by the same accident or the same illness. Now, each member has what we call the initial unshareable amount. And for short, we just call that the IUA. Needs that go over the IUA are then shareable with Sedera. You can submit your bills to be shared using the community's fund. And you'll see there's several different options of IUAs on the screen, ranging from 500 all the way up to 5,000. I'll give you an example of a need, and I'll use myself. I chose the $1,000 IUA when I joined Sedera years ago. It's worked out really well for me and my family. So I've stayed with it. You do have the option to change your IUA annually. So let's say that I'm, riding my bike around town, getting a really bad accident. I can't move. I can't stand on my leg. I have to take an ambulance to the hospital. When I get there, the doctor is taking x-rays. Hey, Julie, it's broken. We're going to put a cast on you. They send me home with pain meds, crutches. I might even need some physical therapy when the cast comes off to heal from the accident, right? Now, because all of these bills are related to the biking accident, it's all considered one need with Sedera. I'm responsible for the first $1,000 towards the bills, right? My IUA, and the community will pick up the rest of the cost. Now, when I walk into the hospital, one of the first things the billing department is going to ask me for is my insurance card, right? Julie, do you have insurance? How are you paying for this visit? And my response as a Sedera member is, I don't have insurance. I'm cash pay. I'm a cash pay patient. you can send the bills directly to my home address. And it's my responsibility as a Sedera member to collect those bills as they come in. I'll upload them using the Sedera member portal, which I can access right from my phone. It'll ask a couple of medical questions about what happened. I'll take images of the bills, hit send. It comes to the Sedera team, and we facilitate the sharing of funds across the community, and we drop the money right into your personal checking account, anything over your IUA, so that you can pay back your provider. A couple reasons why it is super powerful to be a cash pay patient. The first, there's no network. And if you're on vacation with family out in Utah and you're skiing and you get in an accident, that's okay. You go to the nearest hospital, you're a cash pay patient. There's no in-network, out-of-network doctor. The other reason it's so powerful is you typically get a discount as a cash pay patient. It's common we see, depending on where you are in the country, depending on the provider, anywhere from 10 all the way up to 60% of a discounted rate as a cash pay patient. So there are savings to be had when you're cash pay. It's that direct relationship between you as the patient and the provider. They don't have to process paperwork, file claims, pay 2 to 3 administrators to do all of that stuff that's included in the healthcare world today. Lastly, on this slide, because we look at everything on a per incident basis, the most number of IUAs any household would have to pay over the course of a year is 3. So if you had a 4th event, what Sedera is saying is, Julie, don't worry about paying for a 4th IUA. The community will step in and take care of this one at $1. So on the previous slide, I talked about more of an emergency situation. You're rushing to the emergency room, asking to be billed on the back end. Well, what if you're planning care, right? What if you're scheduling out a surgery, or you're scheduling a colonoscopy or some type of procedure? Anytime that you're able to plan care, we've got tools for you to use to shop. We want to make sure that our members are seeing quality doctors that have fair cash pay prices, right? We want to know the bundled price for your knee surgery. What's the anesthesiology fee, the facility fee, the surgeon's fee? We want to know all of that up front. And if you use these tools to shop for your provider, Sedera will waive your IUA up to $1,500. So there's the potential to have your planned surgery, your planned procedure at no cost, depending on what your IUA looks like. I want to give another real life scenario here. This one's personal. I went through this with my son at 8 months old, but this is a family that had a young son with persistent ear infections. They tried antibiotics, they tried booster shots. Nothing was resolving the ear infection. So they were referred to an ENT specialist to have ear tubes inserted into the child's ears. And at the time, they had a $5,000 United plan for the family. So when you take a look at the left-hand side of the screen, you'll see what he paid with the insurance with the $5,000 deductible. Yeah, he got a bit of a break with a copay on the first few office visits. Once it came time to surgery, $2,100 out of pocket, hadn't met that $5,000 deductible, so pretty much paid the whole thing on his own, right? $2,500 out of pocket. Had they been a Sedera member with a $500 IUA, the first couple of office visits would have paid cash. If you're pairing this with the SALA program, which you would be, Rich is going to talk to you about some of these office visits and how you can take care of those. But you'll see, once it came time to see the specialist, you'd reached your $500 IUA. The rest would be shared with the Sedera community. Now, this happened in the fall. Following springtime, the ear tubes fell out of the child's ears, and this process had to be repeated. I think most of us know deductibles reset at the end of the calendar year. With Sedera, we require that you go a full year without symptoms or treatment before it's considered a new need. So in the springtime, when the ear tubes fell out, as a Sedera member, you wouldn't have to pay again. It's still part of the same need because the child hadn't been a year without symptoms or treatment. On the insurance side, you would have paid for all of this all over again, right? Because your deductible reset in the calendar year. You can see what it costs to have a United plan for a family down here on the left-hand side annually. And then, of course, your total cost at the bottom compared to something like Sedera, the medical cost sharing. We do have some limitations around pre-existing conditions. Our definition of a pre-existing condition is something that you've been treating whether that's through medication or through the doctor, or have had observable symptoms for over the 3 years prior to joining. So in other words, we're doing a 3-year look back on your health. Anything that you've been treating, anything that you've had symptoms for, we consider that pre-existing. And the first year of your membership, there's no sharing of community funds to treat that specific pre-existing condition. In year 2, we open it up. You've got up to $25,000 of sharing to treat your pre-existing conditions. Year 3, up to $50,000. And then 4th year of membership, it becomes shareable as if you never had the pre-existing condition. No one is excluded from joining. You can join with a pre-existing condition. But of course, these are the rules that apply to every single person that come into the community. And then lastly, before I hand it back over to Rich to talk about some of the preventive and primary care solutions to pair with Sedera, since we're really there for the big stuff, you've got a really great team that's here to help you navigate being a cash pay patient, helping utilize your membership, helping with the shopping tools to find a provider for your surgery. Our member services team is wonderful. They're super patient. This is new for just about everybody that joins. So with that, I will hand it back over to Rich.
Let me get my screen share back up and we will continue. Okay, thanks, Julie. So we'll talk about the center column and the preventive care column on the right, because that's really taken care of with your e-benefits plans. Again, these are 2 paired solutions that work together for your healthcare. So as I mentioned, there's 2 options with e-benefits. The first is the essential plan. And as I said, both will cover 100% with no copays, the 80 federally mandated ACA preventive care services. Essential is only that. So this is the low-cost preventive care only option. There is a virtual telehealth product that's added into both plans that does take care of things like, you know, if you have the sinus infection and you want to get on an antibiotic, you can use the virtual care for that. But if you're talking about office visits, essential is just going to be those 80 preventive care services, and anything outside of that is going to be out of pocket. Now, as a high deductible healthcare plan, it is structured for pairing with a health savings account. So we do have people that enroll in this product that have an HSA. They love it. They know they may go out of pocket for something like the sinus infection. They're going to pay for that out of their health savings account. And many use the HSA as a retirement vehicle. So those are convertible into IRAs. So we do get folks that just love the HSA approach, and that's what they're going to enroll in. The other sort of demographic that will enroll in essential is somebody who's really cost conscious, or they're the younger person who says, I never get sick, I don't go to the doctor, that sort of thing. On this slide, you'll see the contribution limits at the bottom for 2024. And of course, this is pre-tax savings that can be used for qualified medical expenses. So option 2 is the Summit plan. Maybe 80%, maybe a little bit more of our enrollments are in Summit. Again, it's the same 100% coverage for the 80 preventive care services. It's the same virtual health platform, but it adds co-payments for things like primary care for the sinus infection scenario, or a specialist like the ENT that Julie just mentioned, brick and mortar urgent care. It includes labs and imaging, MRIs and CAT scans, and it's got our prescription drug program. So Essential has none of those components. If you're on any kind of maintenance medication, like I'm on cholesterol, Summit's where you're going to want to go. This is the schedule for the copays, $20 for a visit to your primary care. I should mention too, and I kind of found this out on my own, if you're going to do a virtual health visit with your primary care, that's $0 cost, $0 copay. Specialists are $50, urgent care is $50, lab and imaging $50, and CAT scan $200. The prescription drug program is excellent on generics. There's over 800 generics that are covered at $1 copay. My own Zocor is a $0 copay. There's no monthly or annual limits on tiers 1 through 4. Where it gets jammed up a little bit, like a lot of health plans do, is on the on the name brand medications or the newer meds, or the specialty medications. So there's a couple of ways we assist in that. Sedera's got a shopping service for medications. Sometimes we'll refer folks to the GoodRx Gold program. And we also can work one-on-one with members to look at manufacturers' coupons. In many cases, you can get a very good price with a manufacturer's discount. So we do provide assistance there too. So the telehealth service is provided by Recuro. It has the urgent care service you have kind of come to expect. You know, you're not feeling well, you don't want to go to the doctor, you just want to get on the phone. This works really well for traveling. I've used it twice myself on the road. Within 20 minutes, I was on the phone with a doctor licensed in the state I was in. They phoned prescriptions ahead. So, you know, for my travel itinerary, so I could pick them up in the next town. Worked very flawlessly. But again, this is, you know, kind of the common approach to telehealth. Now, Recuro adds a couple of additional things. They've also got a virtual primary care service, which is great for people in rural areas. They'll mail out test bank kits to you for basic stuff like your blood work for cholesterol and things like that. And you get the same doctor. You pick a doctor and you work with that doctor throughout your experience. And there's also counseling that was added on. So many health programs, a real weak spot is on the psychiatric and counseling side of the equation. So we were delighted in 2022 when Recuro added in a mental health component to the program. So moving on, Julie mentioned that one of the real strengths of Sedera is that with the cash pay approach, you're not working within a network or anything like that. There is a network on the e-benefits side, and it's the Multiplan PHCS network. Multiplan was started by United Healthcare. It's a robust network with over 900,000 participating physicians nationwide. This screen just simply shows what their search page looks like. This was a search that I did about an hour outside of DC for the zip code there, and had 475 results for primary care. So very robust. Only in few places nationally we run into problems. Rural Colorado, occasionally in Alaska, the Florida Keys actually, there were some issues there. So there is a process to get your physician added in if they don't participate in MultiPlan. That nomination process obviously takes a little bit of time, but it's there. Most physicians will opt to go in because the payment schedule is competitive. But also, if you have to go out of network, it's not $0. It's not your entire out of pocket on that. They will pay a base of 125% the Medicare rate. So that was new in 2022 also with the program. It used to be you were entirely out of pocket on it, but they changed that approach. So what do costs look like? On this slide on the left column, you've got the different enrollment types: member only, member plus spouse, member plus kids, or the family, spouse and kids included. The center column is your monthly cost for the essential plan. Again, that's just the 80 preventive services plus telehealth, eligible for the health savings account. And on the right side is the Summit, same categories. Summit is the same baseline as essential, but includes co-payments for specialists and the prescription drug program. The red arrow simply signifies the example we normally give in the presentation. Kevin over here with SALA has some pre-existing conditions. So we use him as our pre-existing condition example. Now, Sedera's pricing is a little more granular. If you recall, Julie discussed the 5 IUA options. We're showing the $1,000 option on this slide and the $1,500 option. They're the most common. But it's also broken down by age band. So like I said, it's a little more granular than the e-benefits pricing. But again, if you look at the arrow for Kevin, he's a person in his 40s. He's single, so he has $136 a month for the member-only price with the $1,500 IUA. Together, Kevin pays $308.62. Now, he was on the Maryland Blue Cross Blue Shield plan, paying just under $600. I think it was $595 or $596. So it wasn't quite 50%, but it's still a good example of the savings that we see in the program. So let me now see if I can show you your website. So we just launched this for you guys. And if you click under healthcare program details, you're going to get to this page. It's going to have some resources I'm going to point out to you. This slide deck is available on demand by clicking this link. We can also set up one-on-one consultations. This is the link to our calendar. So you can just click on that and grab a slot if you'd like to speak to us and go through things like pre-existing conditions or medications, or answer and do a deeper dive into the program for you. And then also there's a rate calculator. So if you click on this, it's going to bring up an online form where you can enter your age band, your enrollment type, which e-benefits plan you're going to go into, what Sedera IUA you're considering, and you can kind of alter those options really conveniently and see what your monthly price is going to be. Under each of these boxes, if you expand them, there's going to be some resources for you, including pricing sheets, information about the plan, the scheduled benefits for the plan. This is e-benefits, the flyers on the Recuro telehealth service, as well as the PHCS search instructions. Now, if you want to send me your zip code, I can just run a directory for you that'll have all the different in-network providers in PDF format, and I can email that back to you. Under the Sedera part, probably the most important document is the member guidelines. It's basically how the whole thing works for you. We'll answer most of your questions. And then there's things down here, and I'll also include the RCI Dental. That's our dental opt-in. There's a provider search here for the Aetna network, and the coverages are all listed on their program brochure, and this is the pricing here. So with that, let me switch back to the slides. And we can wrap up and answer any questions. So it's currently available in 45 states. There are some states where Sedera is not operating in right now. If you're in these states, reach out to me. There's a broker that we use to look at options within those states using different insured products that we can pair. So we don't want to, leave you out there hanging. So there are some options there. We have rolling enrollment is one of the takeaways. So we do not have an open enrollment season at the end of the year. You can join at any time during the year. You can leave at any time during the year. The cutoff is the 18th to be enrolled on the 1st of the following month. There are no minimums, so you can join as a company. You can join as an individual. You're not limited to full-time status or anything like that. So we see full-time folks, we see part-time folks, we see seasonal folks, we even see 1099 contract employees. It just depends if you're a business, and how you'd like to offer this as an employee benefit and who you really want to offer it to within your organization. Again, there's no limits on hourly or salaried staff. There's two approaches. You can enroll directly, set up your own personal bank account for the monthly contributions, or you can run it through an employer account. That's called a list bill, and is a very simple one-page form that we send you to get the information we need to set that up. You'll have your own dedicated enrollment site where you can enroll all the folks within your business. The sweet spot really is the small business and the sole proprietor. For this program. This is why it's really, as I understand your organization, a really good benefit program for you. And again, it has the potential to save on average 50 to 60% monthly. And to just mention again, we have the dental option. So if you have questions, you can go to that page with the link and set up a calendar appointment, as I mentioned. SALA also offers a level of concierge support. So obviously when you're working with Sedera and e-benefits, you'll be working with their customer service teams. But we maintain a level of customer service too for the member. So if you don't understand how something works, if you need to make some changes to your enrollments, if you need new e-benefits cards, if you need help trying to find somebody that's in network, it's been a couple years and you don't remember how Sedera works, you can always email us. That HP support email address I have up on the screen goes into our help desk. Same thing with the phone number there, and we'll answer your questions. We'll get back to you, whatever it takes to make sure you're comfortable and informed on the program. So that concludes the presentation. Hopefully we didn't go too long. Hopefully this was some good news for you guys, and happy to answer any questions you've got.
So let's make sure we share the we'll get the link out, and you're going to see more of this information coming out in emails and such. And again, when this follows up, if you wouldn't mind, we had a question on thank you, and the pre-existing conditions. Again, if you could just kind of touch on that.
Yeah, Julie, do you want to do that?
Yeah, so our definition on the Sedera side, because again, there's no limitations on the preventive care and primary care when it comes to pre-existing conditions. It's just Sedera. If you've been treating something, whether that's taking a medication to control something or seeing your doctor for something specific, within the 3 years prior to joining, we consider that to be a pre-existing condition. And the first year of your Sedera membership, the community won't share community dollars for doctor's appointments and things to treat that specific pre-existing condition. In your second year of membership, we'll open that up and we'll allow up to $25,000 of sharing. In year 3, up to $50,000, and fourth year of membership, it's as if you never had the pre-existing condition. So I like to use the scenario of, I'm a runner. Maybe I have knee pain, whether I'm seeing the doctor for it or not. I know it's there. Or maybe I am seeing the doctor. Maybe I'm getting knee injections to control the pain. I have to know that the first year of my Sedera membership, the community is expecting me to contribute into the community fund the first year before asking everyone else that's participating to share in medical bills that really I knew existed prior to signing up. So year 2, I've got $25,000 to play with for the knee pain. I can get the injections. Maybe I can look into having surgery. There's $25,000 year 2, $50,000 year 3 to play with, and then of course fourth year, it's taken care of.
Yeah, and I can just give Kevin's example real quick too, because we do get people with pre-existing conditions that join. We just don't want you to come in if you've got something active and costly, where it's going to really create a financial problem for you. Kevin's RA, he's had it for years and years and years. It's very stable, and his treatment regimen consists of an annual visit to his rheumatologist and a maintenance medication that was covered in the formulary for the plan. So the thought process he went through was, is this a stable and well-maintained condition that has a low risk of complications that might affect me in that first year of my enrollment? And he determined that there wasn't a high risk of something like that. So he enrolled. It's been 4 years now. I think he's completely phased through the phase in that Julie described. But if you want to discuss it, this is probably the most important part of the program. So if you have a pre-existing condition and you want to discuss it, let's get on the phone or set up a web call and kind of go through it and hash it out and see where you're at.
All right. Thank you. Rich, Julie, that's great information. I've seen these type of programs out there. I know there have been the single advantage I love the most is when you walk in and say, I'm a cash buyer. Suddenly the prices all drop compared to whatever insurance or whatever paperwork. And if you haven't looked into the medical side of things, really encourage you to look at and talk to those intake nurses and stuff who know the pricing, and even the pharmacists who will share that with you. It's amazing the difference when you're coming in as a cash buyer, and I appreciate you guys doing that. A lot of us are cash buyers for a lot of things, which is why it was a little concerning about the cash buying for the for the real estate being a suspicious activity. It's like, oh my word. So
Yeah, it does pull the
I want to
curtain
thank you
back on
guys
the
for coming on
insurance thing
today.
for sure.
Absolutely. There's some profit centers there, aren't there?
Yep.
So,
My own personal
well,
example, Charles, is my daughter had a bad reaction to a prescription medication, and they advised that she get some DNA testing done for those predispositions to try to find out what drug families she should avoid. And the bill came back $5,650. And because that wasn't preventive, it wasn't handled on the benefit side. So I sent it over to Sedera, thinking I was going to be, we have the $1,500 IUA, so we think, great, 1,500 is better than 5,650, right? And the member services person at Sedera emailed me back after I'd submitted everything and said, you need to pay 330. And I said, well, that's not 15. I don't understand. And he said, no, the cash price for those tests is $330. So 5,650 to 330 was just illuminating for me. And we hear those stories all the time. That's just my personal one.
Absolutely. So, all right. Well, we're going to wrap up here today. I know there's going to be a lot of questions on this, but this is going to be information that's going to be shared out. Rich, Julie, thank you for this. Jeff,
Absolutely.
thank you for coming on and giving some updates as well. I do want to give one last heads up, and we've heard this from FBI director has shared with us that the things that were flashing red before 9/11 are literally on right now. So the statement from the FBI director was, it's not a question of if, it's a question of when. So please make sure that you are taking care of everything you need to and make sure ducks are in order, as it were. So just a word to the wise on that thing. So wish everybody the best today. Thank you very much. And again, Rich, Julie, Jeff, thank you guys for coming on and sharing with us all this information. See everybody later.